So how about alcohol in snoring? Let's talk about that little dance.
We can chat about
Or
alcohol.
in sleep apnea, because it kind of goes hand in hand. But so alcohol, why is there a factor there between alcohol and snoring?
I definitely snore more when I drink.
So an N of 1 snore. Is that true for the whole population?
I would say yes.
Yeah,
100%.
Correct. And why? For those that
I mean, it always tends to be more of a alcohol consumption, muscle tone issue, and so it's less. Also changes kind of sleep patterns, and so people, it relaxes everything more, and so
then
you snore more.
Right, and then where's the snoring coming from?
The throat, always, 100% of the time. So
and where in the throat? So the throat, like that, just to kind of connect it out, because people don't necessarily know that.
Right.
You know what I mean? Like they know snoring is annoying, but then they're like, somewhere back there it's happening. It's happening in your throat.
Right.
Period.
How many times in residency, or even outside of residency, did you run into this situation where it's usually a guy, right? So guy comes in, maybe 20s, 30s, 40s, could be 50s, big night out at the bar, passes out at home or whatever, or snores like crazy, comes in, their uvula is like massively swollen.
Sure.
Like touching their tongue, they feel like they're going to swallow it, scared that something's going on.
Right.
And you look in their throat and you're like, oh, did you drink last night? And they're like, yeah. And you're like, did you snore? And they're like, yeah. And I'm like, you just beat up your uvula, you know? And so you're just sitting there just beating that thing up. Now, it's happened to me too, and it's really annoying because you feel like you're choking on this thing.
Yeah.
But, yeah.
So so the alcohol, so the snoring's coming from your throat, the actual sound is coming from your palate, your uvula is the punching bag that's getting punched on when that's all happening. And then, if somebody has a tendency towards snoring to begin with, it's because those areas are lax or the area is tight or the tissue is too loose to begin with. So you slap a little alcohol into their system and everything relaxes more, and then it just amps up everything. The other factor that I don't think people, that's just the throat part, so the snoring's coming from the throat, but I'd say not many of our nose and sinus patients know absolutely that if they have a drink or two that they're going to have a horrible night, and those things come together. So the snoring's coming from your throat, and that's where the sound's coming from. Then you want to add insult to injury, you make your nose stuffier. So when you drink alcohol, it causes, for many folks, it will cause the tissues in the nose to engorge and swell, and then you're more stuffy.
Right.
So your nose is stuffed up, therefore your mouth has to drop open, and your throat is more relaxed because the alcohol, it's like the perfect storm. Like you want to set yourself up for a bad night is, having a few drinks and then going to bed, and then to top that off is just the alcohol by itself absolutely disrupts the normal sleep cycles, and so it's like this. Yeah, not that you shouldn't drink, but I'm just saying,
right?
It does. That's a true. That's not like an old wives' tale. Like that's true. The truth is, if you have any issues where you have a tendency towards either nasal obstruction or snoring or sleep apnea, you absolutely will make those issues worse if you have a drink or two. Period.
And we're realists about things in the sense that alcohol is a big part of culture, and so people are going to enjoy their glass of wine or beer or whatever it is at night, and so I think it's just a matter of helping people understand why things are happening the way that they're happening so that they can make a decision for themselves. Like us at Advent, we're not going to fix everything from a standpoint that if you decide that you want to consume a lot of alcohol, like we can't maybe counteract that completely. That's a factor that plays into it, and so we can certainly prime people for having the best night's sleep they can, but then there's some decision that's involved.
Yeah.
Certainly from their standpoint, right?
Although for the guy or gal
that plugs up, I guess.
The guy or gal who's already sort of getting the elbows and the glances because they're snoring and may have sleep apnea. Now say you're out to dinner with your significant other that you're already annoying, and say you've ordered 2 or 3 drinks over the course of a dinner, then what you know what I mean? Like, where is that night headed for you guys? And it's not going to be pretty, likely. Even if you both are having a few drinks, because you basically every drink that you take, you're telling the person that's sitting next to you, like, I'm coming after you tonight. Like, this is going to be a bad night for everybody here. And
Then it leads to sleep divorce.
Exactly,
Right.
which is something that I think we'll talk about a little bit. But yeah, absolutely. It's like it's sort of like almost I don't know, what is it? It's just, it's adding, it's pouring salt on that wound, I think.
Yeah.
Which obviously can't be particularly helpful. But yeah, so I mean, bottom line though, as far as alcohol, anything that relaxes you, if you have the tendency towards snoring, is going to hurt you that way. Now, if you don't have the tendency, it's not, I mean, it will still disrupt your sleep, but if somebody doesn't have the tendency to snore at all, then a couple of drinks isn't going to get them to snore. Most people, many people, I would say many people, have that tendency to some extent.
Yeah. And then not to get off topic, but then, we see a lot of patients who are on different kinds of sleep aids.
Sure.
Medications, and, whether it's trazodone or, Ambien or some of these other ones that are out there. And so
Right.
what's your feeling on, certainly there are some that are more structured towards trying to keep that normal sleep-wake cycle, but then there are some that are more, sedatives.
Right.
I mean, that can have a pretty profound effect too.
Yeah. And all that stuff just sort of jacks up your your sleep.
Right.
Anything you add on board to your system is going to impact your sleep. Caffeine will do it. Caffeine's the opposite stimulant, but it also dehydrates you. It's just sort of like, and there's a lot of folks, lots and lots and lots of folks who medicate either with prescriptions or over the counter. Like a lot of people have a drink or two for medicinal reasons, and they don't even know that. You know what I mean? Like they know that here subconsciously, but they're actually taking their medicine when they're having a couple of drinks, and so like the alcohol, will aid in kind of unwinding. It's true. It's a depressant that way, and then you got to have caffeine to jack you back. Like it's just like the perfect storm. Like have a couple drinks, have a crappy night's sleep, wake up in the morning feeling crappy. Hit the caffeine hard to get your system revved up, and then rinse and repeat over and over again.
Right.
And that's okay. It's not optimal. And it's fundamental.
It's a lot of people's lives, though.
That's a typical story. And then I don't know. We're not here to solve all the world's ills or problems, but I'd say the core issue there, though, isn't necessarily the drinks or the caffeine. It's a reality that if you want to guarantee yourself a horrible night's sleep, then compromise your airway. Airway meaning your nose and your throat. Like I can guarantee you, and they've done studies with this where they take people and they put a little clothespin on their nose, have them go to sleep, and they have horrible night's sleep. They snore like crazy. It's miserable. And so, absolutely, if you want to compromise your sleep, compromise your airway. If you want to maximize your sleep, optimize your airway. It's that simple. And so, for those who are walking around with compromised airways, they tend to do things with, like I was just saying, medicines and alcohol to try to sort of deal with it. Whether they know it or not. And so meaning like a lot of people walking around with clothespins on their noses, like not literally, but internally, they don't know any better. And so it absolutely is going to push their buttons.
Well, and a lot of those sleep issues are related to, so nose is stuffy, poor night's sleep, so now you're taking a sleep aid to try and get over
sleep.
that hump to get to sleep,
Right.
which is making your sleep worse. And so, and even alcohol too. I mean, obviously people enjoy having drinks and as do I, and you go out and maybe have a drink and things like that, that's okay. But it's when you're seeing all these people who have trouble falling asleep, trouble staying asleep, plugged up noses, now on sleep medications, that to me is like the perfect patient too, where I'm like, ooh, if we just get your nose working, maybe the anxiety you have around trying to fall asleep and waking up and like just not having restful sleep at all, assuming you don't have sleep apnea but still struggle,
Sure.
we can maybe get you off those meds, or
Right.
like hopefully that can be a goal, right?
Yeah, absolutely. Yeah, I mean, sleep apnea. So to reiterate, I say this all the time, but everybody who has sleep apnea snores. Not everybody who snores has sleep apnea. So it's a continuum. So if you snore, that means your throat's tight and then the tissues are vibrating. That's where the sound's coming from. If you have sleep apnea, things are so tight that they're vibrating, and then there are times where it just shuts down back there. I mean, so it's a spectrum. So certainly those whose snoring is made worse by sleep apnea, or I'm sorry, those whose snoring is made worse by alcohol, that's absolutely going to happen that way. If you have sleep apnea, it's going to make those issues worse too.
Yeah.
If you're not treating it. Now,
Yeah.
the upside, not if you are treating your sleep apnea properly, properly meaning whether it's a CPAP machine or oral appliance or whatever the case may be, doesn't give you license to go to town, but I'd say then at least you've got something that's going to be fighting back when you're sleeping at night. If you have untreated sleep apnea and you have a couple of drinks, it's physically doing you more harm that night than than a typical night for you. The snoring is going to be bad.
Yeah.
It's just going to be a bad situation.
Yeah, it'll
all around.
worsen your sleep apnea.
Yeah.
Whatever your baseline is, it's going to be worse.
Correct. Yeah, it'll make that situation worse.
Yeah.